To make an update
Stay
to
there?
the minutes. If you're
Sure.
gonna
I guess it's on my side.
with 1, 2, 3, 4, 5 present and 1 virtual.
One virtual, okay. All right. Okay, so we will, we'll call the meeting to order. And we'll start with the Pledge of Allegiance. Could somebody lead us with the Pledge of Allegiance?
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. So today we'll be talking about the HFI funding changes, existing contract, and then HFI updates. So could we take a moment to review the minutes from the last meeting? And if everybody agrees, we will adopt the minutes.
Motion to approve.
Any seconds?
Second.
All in favor?
Aye.
All in favor? All right.
Do you want to look at
Are you-
No,
are
I
you-
know, I've seen them, just had a correction.
Okay.
There was an addition.
Oh, okay, please.
The name was left off of the last minute and it has been submitted.
I see. So there's a correction to the minutes.
Yes, so I already made the correction, and the top page that you have there is the corrected one.
This one here.
The loose page.
This
It
is
looks
the new one.
New one. Okay.
Dr. McCall was left, her name was left off the other one.
Okay, very good. All right.
Redo this.
All right. Okay, very good. Okay, Sheila, could you tell us how to go about the HFI funding?
Of course, yeah, we
Yes.
just wanted to give some real quick updates on the HFI funding changes and some of the legislative changes that happened recently, just to make sure that you're all aware. You ready for me to pull up the slideshow? You got it?
Yeah, please.
All right, terrific. So really quick, we're just going to review these just to make sure that you guys are aware. I know it's been in the news, but just to make sure that you do know, our HFI funding for the entire state has gone from 150 million to 40 million to split between the counties. They still kept in the requirement for the 40-60 split, where only 40% is dedicated towards regulatory services, and they kept in the 10% maximum on capital. So that would be things like land, vehicles, that sort of stuff. So for here in Lake County, our funding has gone from about $6 million to $2.5 million. And IDOH recommends using alternative funding streams, grants, county funds, possibly opioid settlement, to accomplish some of our goals. Internally, we are reviewing all of our processes and operational operations to ensure that we are optimizing all funding and thinking financially, strategically. I'm going to go over some of that a little bit later. One of the other changes was to the tobacco prevention and cessation core service that was removed from the requirements. We can still work with tobacco cessation and prevention when it is with the youth and when it is with maternal and child health. But as health departments in Indiana, we will no longer focus on adult prevention. They do have, Indiana has the Tobacco Coalition that can help with those efforts. And then that does go into effect on July 1. They did say that if any counties had a KPI specifically related to tobacco prevention and cessation, that they remove that, but we do not have that KPI here in Lake County. And then the last change I want to talk about is to House Bill 1427, where it says that funds may only be used for Indiana residents who are lawfully present in the United States. We're currently looking at all of our HFI activities, working with our attorney and our auditor to ensure that there's no issues with that here in Lake County. That does only apply to HFI, Health First Indiana fundings. And then we are working to address that with all of our existing HFI contracts and any contracts going forward. And then now Michelle is going to give you an update on where we've been with our current contracts. I'm going to have a seat.
Can you give me a second, please?
Thanks, Sheila.
Oh, you got it. Okay, so I do like to start with who our active programs are. So as you see, we're adding to the list of our active partnerships. Since our last meeting, we had added nutrition education with Purdue. Our overhead lockers with the food bank is officially in process. We're very excited about that. We've still working with Indiana University, St. John, Mental Health America, Victory for Kids, which I did just find out they, at their Youth Career Expo, 2,600 youth came through and were educated on many, many different topics. All 2,600 were educated on breast self-examination. So I thought that was really great.
Wonderful.
We've included Faith CDC, the Food is Medicine program, For the Love of Arts, Sounds of Sarah, the Papa House, which is Camp Dean, Determination, Enthusiasm, Achieving New Levels, the Aliveness Project, and Safe Coalition for Human Rights, A Better Way. Since our last meeting this past quarter, we've developed an HFI steering committee, and this committee is an internal review committee that will help us steer where the funds are going into the remaining of 2025 and where we're heading into 2026, 2027. This is especially important, as Sheila had mentioned, our funding. We want to make sure that we're prioritizing. So in conjunction with our community needs assessment that we'll be rolling out very soon, we want to make sure that we have that kind of target of where we're headed and make sure that we're prioritizing. So our internal committee consists of myself. We have an environmental representative from the health department. We have one of our HIV surveillance directors on the committee, and we have a school health liaison and nurse. So we are reviewing internally and hope that this just gives you the feedback to help streamline one of these meetings, but increase the transparency so that you know that we are really going through and diving in, spending numerous days, numerous hours on all of these programs. Looking ahead, our next funding cycle will open up between July through September with a focus of our 2026 funding applications. In the committee, I wanted to share with you a little bit of the tools. As we said, we want to increase the transparency. So we are going through a number of categories, like does the program touch and demonstrate the needs and alignment with our core public health services and our local KPIs. And just a refresher, our local KPIs are our maternal child health, our overdose prevention, our immunization. And what are the methodologies? Do they have SMART goals? We're evaluating the capacity and the experience of the organization and the program. The budget, we're reviewing each of the budget's breakdowns. And we're really looking at that sustainability because we know that the funding climate is changing. We want to make sure that if there are any funding cuts in the future, we want to make sure that these programs are able to be sustained. And if not, we need to know. So with that being said, the score, we grade a 1 through 5, 5 being excellent, 1 being poor. Then we multiply and we get a weighted score. The review committee will give any comments, notes, and during the review process, we reach out to the applicant if we have any questions, need any clarification. So we're hoping, again, that this streamlines the board meetings. After the weighted score, you get a number, like I said, 1 through 5, and then we'll take the average, and then that's how we move forward. So we have decided as a committee that you have to meet criteria 3 in order to be presented, and that means that you've hit all of our priorities and everything's pretty much well up.
If they do end up with a 1 or a 2, do they have the chance to go back and modify their application or their program?
We have any of the areas where we have any questions, we reach out to the applicant and they can resubmit within that time. If they do and we are still kind of uncertain in some of those areas, then
they will go into they can apply at another time. It keeps it kind of competitive
Yeah.
a little bit. So just to give you a little bit of a breakdown of or a visual of our current funding and our proposed funding, the green here is our actual funding. And I just wanted to share this. This is in each of the core services. So it'll give you a visual. I like it because it lets you see that we are focusing on those top priorities in our county. And even with the projected, the blue, if all of the programs on the agenda today were to pass, you can see that we are still, again, in our top priorities. So that doesn't mean that we're not funding other areas, but it just gives you a visual representation.
Quick question.
Mhm.
It seems like tobacco is having and getting very little attention, given the danger and the problem associated with tobacco use.
Mhm.
Is there any reason for that?
Well, so the funding has been cut for the tobacco, but there are other areas in which tobacco is addressed. So like maternal child health and student health. So you may see maternal child health here. That will include like prenatal assistance or kind of getting those preterm birth
Cessation.
rates down and all that stuff.
Okay,
Yeah.
thank you.
As well as student health. And then this will be going away after July 1st.
Okay, we're at grant review. Thank you very much.
Can I just say one
Yeah,
thing?
sure, go ahead.
Michelle, I thought this was excellent.
Yeah, very nice.
Like, I'm a visual person, clear, where it's going, besides that we're equal, the funding that we're doing, and plus to be able to get more with that dashboard.
Yeah.
It's just excellent to have the data ahead of time so we know what we're moving on. So it's excellent job.
Yeah, thank you very much. All right, so we have the ratification of Methodist Hospital contract from February. You have people from Methodist Hospital?
So just a little background, that
Okay.
is just to ratify what was voted on in the last meeting, because there was a little confusion on if we had a quorum or not. So now that we do have the quorum, we will just ratify your vote that you put forward at that time, and that was for the contract that went through before for Methodist.
Do we remember what the contract is supposed to be, since we are going to ratify?
Michelle, will you update them on which one that one was?
There were two.
So the Methodist was the Star Center, the Sexual Trauma and I think Recovery Center, and then the MCH clinic. So I know the Star was implementing a forensic nurse, making that a 24-hour operation because they had lost their funding. And then the MCH was, I think, another. I'd have to pull it up, but I think it was another nurse, also another 24-hour operation.
Thank you very much. Since we ratified it before, but we were worried about quorum, we're in a good place to ratify this one. Can we entertain a motion to ratify it again? Okay. Any seconds?
Second.
All in favor?
Aye.
Aye?
I have to abstain.
Oh, you have to abstain, okay? All right, so the ayes have it, the motion carries. Thank you very much.
Yeah, yeah.
All right. So, we're in the first Indiana contracts proposals.
And I would like to say on behalf of the HFI steering committee, like I said, we spent days and hours going through all the programs, all the applications, and just a huge thank you for all of your thoughtful applications, all of your thoughtful programs, all of your thoughtful responses, and to everything that we asked. It was very humbling, very rewarding to go through and see all the impactful work that you guys are doing in Lake County. And thank you very much for that. So we're very happy to present these to the board on your behalf. So thank you. We got the presentation.
The same one?
So the first application, we have Community Advocates of Northern Indiana. They do have two applications up. The first one is Love Mom. program. The funding request is $48,506. You'll see on the agenda. The Love Mom program is dedicated.
Hold on,
Oh, you took it off of there.
I'm not sure.
Okay.
Sorry about that.
Okay. Love Mom program is dedicated to improving maternal and infant health outcomes through comprehensive, free, and evidence-based doula support. So this was implementing 2 doulas in their program, community baby showers, which they will have quarterly baby showers, and each participant or each mother gets a choice of a special gift at the baby shower. And the Have a Healthy Baby Health Intervention. The mission is to empower expectant parents, particularly those at elevated risk for poor birth outcomes, by providing continuous emotional, physical, and informational support during pregnancy, labor, and postpartum. I will tell you, the committee loved this program. It scored a 5 across the board. And our committee feedback was, we love Mom.
All right, do we have a representative?
Yes.
Welcome on down.
Good morning.
Good morning.
Thank you so much for having us here. All the tremendous work from Michelle. Thank you.
Do we have any questions about it?
So we had gone through like some of our the programs. So on the Board of Health dashboard, if we had any questions, I added them to that. So
Okay.
we do not have any questions. Are there any questions that you all may have?
Yeah. No?
No, my biggest question is, being an OB, you still have these programs that are reciprocated, are duplicated. How do you plan on,
Improving.
or changing,
Maybe coordinating.
right?
So if I can ask for an example, the programs that you're saying are duplicative?
I would just say the baby shower, program, when you have the mothers give them the baskets and all of that. But some other agencies do the same thing, so.
Absolutely. That's a great question. I appreciate being able to respond to it. So we are collaborative. We collaborate with everyone in the area so that when we have a Love Mom's baby shower, it's actually a demonstration of that from the community of those of us with aligned missions. And we want to wrap Mom with all the resources that this region can provide. So that includes healthy families, it includes nurse family partnership, it includes Marum Health, and on and on and on. So it's an actual time where there's resource sharing. And so we meet as partners. We're part of LCHD, the Lake County, it's a maternal community action. And so that's also a time where we collaborate. But I will say we always have a waiting list for that, because as much as I know the city of Gary just had one, our partners at HealthLink there still isn't enough for the moms that are out there. So we look forward to being able to expand what we're already doing. And if I may also interject, we have embedded in that baby and me tobacco free. Thank you.
How
Thank
do
you.
moms access the doulas?
So we have a number of different entry points, but while we're out in the community and we're everywhere, where there's a health fair, whatever. So we do outreach throughout the county, and then moms can make, we get lots of word of mouth, lots of our providers and partners, and mom can call. We've got some QR codes out there, just a number of different ways mom can access.
Thank you.
Are there ways that providers in the community are aware of these programs?
Yes, that's a part of our outreach.
Outreach, okay.
Yes.
Thank you. All right, can we entertain a motion to approve the grant?
Motion to approve.
All in favor? Aye.
So next, again, we have Community Advocates of Northern Indiana, the Stronger Together program. This ask is $82,456. I did put CANI, but that is Community Advocates of Northern Indiana. We'll deliver community-based education, wellness promotion, and maternal health support through workshops, school programs, and clinical partnerships. This is to implement 2 evidence-based public health interventions, the Eat Healthy, Be Active community workshops, and the Baby and Me tobacco-free, as Ms. Lewis was expressing. The grading score mix that the committee said was 4.3. The feedback was the original salary breakdown had just had a couple of numerical errors. Was incorrect. It needed clarification, but as we do in the committee, we reached out to the applicant and allowed them to kind of fix that budget piece. The sustainability lacked a little bit of detail in the application. However, the evaluation plan was very good. So again, we gave a 4.3 for Stronger Together.
All right, do we have a representative?
Yes.
Ah, yeah, you too, okay. All right, any questions from the board?
My question again is, where is your entry point? Because in all honesty, most OB groups, federally funded, clinics, we provide all that. So where are you hitting other areas, to reach all of Northwest Indiana?
With the schools, with the daycares, and again, as we're out in community, at health fairs, back to school fairs, all of those kinds of things. We get lots of referrals from the schools though as well. And so with this one being really Eat Healthy, Be Active is something that is also through the summer with WISE and all of our community partners where community is convened, but then we're also out in community connecting with those providers and folks on the street. So we have forums where we'll go to, sometimes we'll go to McDonald's and we'll do an assessment there and folks can sign up at places like that. Or again, if we're at health fairs, but lots of things happen through the schools and our community partner efforts. And so we work closely with all of our community health centers, as well as I say, the WISE, the Boys and Girls Club, and the strong partners are the churches.
And the committee, I do just want to bounce off that. Great job. The committee was with some of our feedback that I did not include here, but on the capacity piece, we did notice that CANI's partners were like Franciscan Health, so they have that really good capacity and they scored very well on that piece with the community partners, as she mentioned.
This KPI specifically is for chronic disease prevention, unlike the maternal health one for the previous one. So it might touch a little bit on something outside of the maternal health. So
Have you identified the program coordinator?
Yes.
Who is that?
Nicole Otis.
And they'll separate the 2 fundings because she talked about this first one and then this one. So you want to make sure there's not an overlap. Like borrowing from one to help the other one because it is 2 different presentations. But it's the same person.
Yeah.
2 different KPIs also, so the tracking will be different.
And the reporting would be expected that each program gets their own report each month. And then all programs are subject
Very
to
good point.
audit.
If it comes in one report, right,
The report is monthly.
Yes.
good point.
Unless otherwise specified, I'll work with them, but most of them are monthly.
Question, when you say the active community workshop, what kinds of things do you have available to teach people how to be active?
So this is from the CDC, Eat Healthy, Be Active, and so it includes for different age bands.
Mhm.
So for kids, we're teaching how important fruits and vegetables are to integrate. In fact, we're teaching that across every age band. But just say for kids to know that in addition to being active and doing athletic things at school, how much vacuuming, how much doing their chores is actually also a way to be active. We teach that as well to adults. We're also teaching them about the importance of the balance between mental health and being fit and exercising and things like that. There's cooking demonstrations. If I could look at my sheet, I could list. It's about 14 modules. And so it really just walks folks through in your everyday life. This is how you can do self-care, be healthy, and how important it is. If you're going to be healthy, you're going to have to be active.
I noticed you said something about mental health. Is there any room in this program for mindfulness, meditation?
That is also.
Because in this day and age where we're all stuck on our phone, our minds are everywhere except in our bodies. So is there any way we can include that as part of this, or is it already in there?
It is integrated in there.
Oh, very
Yes,
good.
sir.
Excellent. Okay. Any other questions from the board? And with that, we do entertain a motion for approval.
I would make a motion to approve.
Any second?
Second.
All in favor?
Aye.
Aye? All right, the motion carries.
Okay, for the next agenda item, we have For the Love of Arts, Shine Cafe. The funding request was $144,000. The program provides peer support services, including recovery circles and individual support, complemented by transportation assistance. If you remember, For the Love of Arts, in the last meeting in February, as of April, we have partnered and got the transportation van for the Love of Arts. They've already provided, if you recall from the monthly reports for April, 146 rides just in the month of April to peer support, recovery, courts. There's a ton of places. I'll leave that to you. The committee graded an overall 4.7 and commends the strong community partnerships and active engagement with the county courts, noting this reflects strong organizational capacity and they support the focus on recovery and program activities, find staffing expenses reasonable, and recommend strengthening evaluation and measurement efforts. I do want to note that while we do recommend the strengthening of the evaluation and measurement efforts in communication with For the Love of Arts in the last or in the first April report, it was noted that the reporting methods that we use are helpful in determining the way that they will be reporting out moving forward. So we do anticipate that while we did kind of see the less engagement of the evaluation and measurement, we do anticipate that it would be increased. So we did note that.
All right. Any questions from the board?
Hi.
Yes, hi.
Just wanted to say hi, I'm
Well
Jenny
done.
Carrasquillo, and I wanted to thank you all again for our vehicle. It's been amazing being able to transport people, and it's all free, so thank you.
Excellent. Any questions?
Yeah, is the program coordinator, is that the one who's driving the van?
No, we have a driver.
I was looking at the budget for the program and the administrative costs are like 70% of the whole operation cost. And a lot of it is, I just thought that was really high.
Well, that's just for this proposal, so that's not of our total budget. So for example, we have meals and other services that we provide that aren't on there. So this
Okay.
specific contract is for our staffing and supporting our administrative expenses.
Okay,
All right.
I make a motion to approve.
Any seconds?
Second.
All in favor?
Aye.
The ayes have it.
Oh, Dr. Sorry has a question.
Oh, I thought you said aye.
Oh, I thought maybe you did.
I did, okay.
Oh.
Okay, good. So the ayes have it.
Okay.
All right.
Very good.
The motion
Thank you.
carries.
Thank you all so much.
Thank you very much.
So next up, we have City of Crown Point Mobile Integrated Health with a $200,000 ask. The goal, just to note, Mobile Integrated Health is currently operating in Crown Point, and we do, as a health department and IDOH, highly encourage all local fire departments to implement mobile integrated health. So this is to kind of expand their program here. The intent of the Crown Point Fire Departments to continue finding collaborative approaches among a wide range of healthcare providers and professions to make it more widely available. We graded this a 4.9. Overall, the committee shared the same enthusiasm with the Crown Point Fire Department to champion MIH training to other local fire departments and loved the Fire Safety Week for schools. I'll leave that.
Any representative?
Hi, good morning.
Welcome.
Mark Bumgarner, Fire Chief from the City of Crown Point, and Kevin Leduc, who's our program coordinator for our MIH programs and several other programs we already offer.
Excellent. Any questions for the representative?
So this program is similar to the St. John, correct?
So this is yes, very similar. So we do have the St. John Mobile Integrated Health, and then this would be the Crown Point Mobile Integrated Health. We did have a slight concern that, you know, it would be operating within, you know, close jurisdictions. However, again, we do recommend that all local health departments have a form of a mobile integrated health in their areas. And there are some health departments like Crown Point, for example, that has those jurisdictional restrictions in their area, so that they mainly have to work out of Crown Point, except, you know, they're working with like different MOUs. So to have those in place, then they would be able to expand, so they'd be able to work on that. However, the enthusiasm with being a trainer for, you know, other fire departments in the county would help them expand.
St. Bloomfield?
So this proposal does not include the City of Crown Point and Center Township, which is incorporated. That's our area of jurisdiction, our legal area of jurisdiction for our fire department. There's a lot of areas that would consider Crown Point that don't fall under us. But the way it's been structured through legislation and the State Department of Health and Homeland Security is they've tasked the local fire departments to run with MIH, or community prevents, it's also called. So the biggest restriction to that is we already have kind of jurisdictional boundaries. That doesn't mean that you can't break those boundaries through MOUs and different things, but each individual department and those cities or towns have to also be willing to commit the time, resources, and personnel. So those are obviously bigger discussions. It can't just be, I can't just go to the Maryville Fire Chief, like, hey, you want to do this? And he said, yes. It's got to go through the whole. So we've already, the City of Crown Point, we have already been doing a lot of these programs for a while now, self-funded. Some of these are new programs we're going to be able to offer. A lot of it's be able to expand currently what we offer. CPR classes to the community, which I should back up. This isn't just covering MIH, it covers other programs too. MIH is specific to the jurisdictional boundary of City of Crown Point and Center Township, because we go into people's homes. We get that information, we get those referrals from our own people that respond to these homes on calls, and they see a need. An elderly lady who keeps falling. Well, why are they falling? It could be a number of reasons. Historically, in ambulance, we pick up, we transport, we treat, and end of story. So MIH will be able to kind of do follow-ups to see why they're falling, tripping, be able to spend time to fix the issue, to prevent. This is kind of like fire prevention for EMS. But also the other programs we offer, community CPR, car seat installations, those have really no jurisdictional boundaries. We open up our appointments and those classes to pretty much anyone that wants to take those classes. So specifically MIH is jurisdictional, not City of Crown Point, just like St. John's jurisdictional, but a lot of these other programs we open up to.
Quickly, in your program, you have something called Stop the Bleed. What's that?
But
So Stop the Bleeds by the American College of Surgeons and the American Heart Association. So it's basically you'll see now 80s in public also have tourniquets. So it's basic first aid for stopping, unfortunately, 2025 in America. There's
A need for it.
a need for that.
Okay.
So yes, and and the schools, K through 12 schools are required to have that training,
Okay.
required to have those kits.
Okay.
But you're starting to see those a lot more in public areas. So that stop the bleed is just it's kind of like CPR training for
Basic first aid,
For-
yeah.
for trauma. Thank you very much. Any other question from the board? Can we entertain a motion from the board for approval?
A motion.
Any second?
A second.
All in favor?
Aye.
Aye. Aye, all right.
Thank you, guys.
The ayes have it. Thank you.
Okay, next up, we have St. Jude House, maternal child health for survivors. This is an ask of $154,263.10. The program will include a range of medical services such as routine checkups, vaccinations, treatment for injuries and illnesses. Additionally, they'll provide mental health support through counseling, therapy sessions, and support groups. These services will be tailored to meet the unique needs of the mother and children who have experienced domestic violence, ensuring they receive compassionate and effective care. Overall, the committee was very pleased with this program and graded it 5 across the board. So you had the average of grade 5, so it was excellent.
Thank you.
You're welcome.
Any reps from, yes, please.
I'm Anna Schoen, I'm the executive director at St. Jude House, and I have Chris Cospaid from our team with me this morning.
Thank you. Yeah, go ahead.
Question, what area will this program?
We serve all of Lake County and some additional counties as well.
What is the number?
We serve about 400 survivors a year.
You're talking about domestic violence.
Domestic violence survivors.
With the council you guys do provide, is that contracted out or you guys have no?
This grant would allow us to hire a person to do that in-house.
Oh, nice.
Any other question for this rep? From St. Jude? If not, any, none? Well, let's entertain a motion for approval. Any the motion? Yeah?
Yes.
Any second?
Second.
All in favor?
Aye.
Aye, the ayes have it. The motion carried.
Thank you.
Oh, no, Sheila.
I think you're on, I think you're good.
Okay.
That's your nail polishing.
Oh, yeah. Good, good. So next up, we have the Gatehouse. I do want to say on the agenda, you have 4 applications. I would like to personally note that that is on my recommendation because they touched on several different core public health services. I wanted to ensure the safety of the program itself, so I encourage them to break it up. That's why we have the 4, but still within that budget cap limit as a total.
Okay.
So the first up, we have the Sober Life, Healthy Life. $50,000 request. The Sober Life, Healthy Life program educates and engulfs newly sober women in a 12-step recovery program through residential recovery. And this is caring for their health is a low priority for most women new to recovery. Sober Life, Healthy Life offers and encourages access to doctors, practitioners, and medical supplies to screen and treat chronic disease. We graded 5 across the board, gave you the average of 5. The committee appreciates the value of interactive dinners with this program, considers the budget of request very fair, and supports the emphasis on sustainability, smart cooking, and shopping. They also express interest in establishing a strong partnership with the food bank. So that was our feedback.
So maybe what we can do is to go through
Sure.
for time's sake, yes.
So this first one is on food.
This one, this one.
This is sober life.
Right.
Right, but
Right.
it's,
So it's encouraging a healthy lifestyle
Style
for
for food.
people in sobriety.
yeah,
Oh,
it's the interactive.
Like the next 4, the next 4 of these is
Okay.
the same thing.
So Then we have the Autos for Access. This is to implement that transportation piece for all aspects of mental and physical health. Care increases the residents' success exponentially. We thought this was a very practical ask. Again, we graded a 5. The non-pre, during, and post, the Gatehouse is a women's recovery home. They have 24 beds and they are expanding to 26 for women and their children. So the purpose of this grant is to ensure that, again, they have the healthy body and offering access to doctors, instructors, treatment materials, and healthy food, which will in turn help the maternal mortality drops significantly. Again, a 5. We did inquire about the success rate, and we were pleased to learn that through their program at the Gatehouse, they have an 80% success rate of women who remain longer than the recommended 6 months in their program and leave the program sober. So I was happy to hear about that. And then the next one, we have the Sober Living for Women. This is to, expand on that 12-step program, implement the MRT and recover coaching. The attainment of general well-being follows sobriety, greatly reducing the risk of trauma and injury suffered by residents as well as their communities. This was graded a 4.9. The initial application lacked that data measurement, but that was provided, and that was that 80% that we had. We just scored this one first, got the data. So again, excellent budget, and we felt that this was an exceptional program. And to give you a rundown of all of the to encompass all of these programs together is to increase the access with that transportation and to take on a food pantry for all of these homes and all of these women that they're providing residents to throughout the program. So as you saw, it was kind of like a food pantry, a food bank at the location so that they can provide that. And some of the programs implemented those interactive dinners and that peer-led shopping experience at the grocery store. So we thought that that was really an exceptional piece.
Hammond.
No,
All 4 of them are in.
That was a,
That's one more, I think that.
No,
no, that's
That's
for,
it, okay.
oh my goodness. Okay. Okay.
Michelle, that's one of the big problems I see is communicating or letting people know where these programs are.
How
You
to
know,
access.
how do you get access to them? I've been here all my life and I said, where does, So if I haven't, so where do other people get to learn about these programs?
Leslie and I both made Denise, this is Leslie, she's the director. We work closely with the jails, the drug courts, and all the rehabs. So our name is out there, and plus we're both in recovery and we have been for a very long time. So we're very well known in the recovery community. We have a web page. We've been doing this on our own without any funding for the last 3.5 years. And using our vehicles to get everybody everywhere and the doctors and probation and all that. So we're well known in that area.
Recommendation is, maybe the court might know, but a lot of the physicians don't know this information. And at the hospital, this is where we meet and greet some of these clients. So
we would like to do more of an outreach, but we've been so busy because we don't have any employees with our boots on the ground trying to get 26 people coordinated that we haven't had time to do any kind of an outreach at this time. But absolutely would love to get, our intention is to do that.
I think too,
Yeah.
your capacity to be able to help is limited.
Yeah.
Obviously, so, you couldn't take an influx
No.
of referrals or people anyways.
And we do get referrals from a lot of doctors and the courts if they see a problem, if the person is a drug addict or an alcoholic. But the thing is, just because the doctor knows that they're a drug addict and alcoholic, do they even want to do anything? So our program is really for people who are seriously wanting to get sober, because they won't stay the 6 months if they don't, regardless of what the doctor says, regardless of what the judge says. If they're not going to stay sober, they're not going to want to stay 6 months. We are limited as to how many people we can help. Like she said, it's just the 2 of us, and hurting 26 people is like children at Disney World. They're every direction at one time. And it's very difficult when it's just the two of us. We depend on peer support, we depend on the recovery.
Do you take
Community.
contributions like clothing?
Yes, we do, absolutely. And see, the thing is just like with Haven House, it's private, they don't let you know where they are. A lot of times, in the general public, they're not really into recovering people. They hear drug addicts and alcoholics, they don't want us near them. And so we try to keep it quiet. We don't want people to know that there's a house full of women. They figure it out eventually when they see the women coming in and out, but we don't want it out there well known that this is where all the women are living. And we try to protect our girls, try to keep them safe until they're able to do that for themselves.
What do you guys do specifically to help them be sober and stay sober?
We're like their moms. A lot of girls that are at the house have not been raised. They've been housed. A lot of them have gone into incarceration really young, or they've gone into juvenile detention. They've had parents who were drug addicts or alcoholics. A lot of them weren't given the things that we were given growing up, and we still became drug addicts and alcoholics. But we give them that ear, our experience of having gotten sober. We share our experience as parents, because a lot of them, a few of them will go with them to court, and we'll stand with them and we'll help them with DCFS because they're afraid. And so we do what mom would do. We go with them, we stand behind them, and sometimes we help them get their communication out there because they don't know what to say. That's what we do. I mean, we're there. We take them to the doctors. We take them to court. We take them back and forth to work a lot of times. And it gets really difficult when there's just two of us.
You can explain MRT. I think that would also be very helpful.
Right. MRT works out of workbooks. So the ones that we're wanting to do is the parenting, also relapse prevention, and there's one about finances as well. You'd be surprised how many girls, no one has a bank account anymore. They all do Cash App, or they don't do anything. So there's no finances. They don't know how to budget their money. They get paid, they get nails and eyelashes. And we usually frown on that. We tell them that we need to prioritize our money. We need to pay our fees first, then we go and do the things we want, or we save up for future apartments or cars. So that MRT is about learning to think differently. And we wanted to do that for a while because it did work out for us. We were doing it before. And it just gets really expensive with the cost of the books and everything with that many women.
Have you guys considered, because just the two of you, the program will always be limited to the two of you. Have you considered recruiting some of the people who are successful and want other people to be successful and expand the program thus?
And that's exactly what we've been. So we have a few girls that have already graduated. They've left the house, they've gotten their kids back, and they have their own place. We tell them that we're training them to take over for us. And we look forward to those girls that have been successful. We have a girl that was with us for 2 years. She moved out, got her kids, and she helps us so much. She will be giving a few of the MRT classes.
What is the length of time that a person would be? I know the 6 months, but what is the longest?
They can skip to 2 years, but we have someone that's there like 5 years because she's going blind. She has no family. And so basically she's one of ours. So she's our senior resident. She watches the girls. She coordinates rides. She coordinates who's picking up what house and who's going to meeting, who's not going to meeting. So she'll probably be with us forever, I would imagine.
Do you guys have anybody that consistently contributes monetary?
No. My husband.
Any other questions from the board? Yeah.
So you usually have around 26 moms a month?
We have the same ones. So the girls are there, they have to make a 6-month commitment.
Right.
What we do offer is that once they have a year and they move into a 3/4 section, they get their kids back. So now we have a toddler. So we have a girl that just moved into a downstairs apartment with her toddler, and now she's trying to get her 9-year-old back. So we make that, they give them that apartment. She doesn't have to come up with first and last, right? We pay the electric and water. But yet she's close by that we can, help her out, babysit, help her get on her feet.
So what is the turnovers usually like a year then, or? So, and you guys usually, your program, you're filled to max, like usually, okay.
That's interesting. All right, can we entertain a motion?
To-
Are you going on?
All of them?
Oh, no, all of them.
Yeah.
So,
All of them.
thank you for your questions. We gotta limit them just to the board to ask the questions in these so that we can get the budget approved. But I'm sure you can get their information to ask them these questions. Thank you though.
I make a motion that we approve all resolutions with regards to the safe house, gatehouse, sorry.
All in favor?
Aye.
The ayes have it, they confirm. Thank you guys for what you do.
Absolutely.
Yeah, yeah.
Okay, next. Next we have St. John Fire Department, Mobile Integrated Health. This is an additional request for transportation. We know our Mobile Integrated Health Deputy Chief Mike Sharp reports every month. The program currently has one vehicle that is operating and is limiting the number of visits as the patients are scheduled around the one vehicle. So this program is to purchase 2 additional vehicles to allow them to increase their coverage, which was part of the original contract. They are able to expand out into those other areas of the county, but they have been limited. This is a continuation of that growth and service expansion. We graded 5 across the board, and we were very pleased to see that we love the expansion going through Lake County.
All right, any rep? Hello. Good morning.
First, thank you for giving us the opportunity to not only start our programs, but grow our programs. As she stated, we've always known that the need is going to outweigh the resources that we have. So we plan that growth accordingly so that we can go farther in the county and not just be limited to our own little area. Since the beginning, this growth has been planned, but this has always been a concern area. Is we have one vehicle, we have 11 people trying to see patients, trying to do classes. We've been all the way to Whiting, to Hammond. We've been throughout the county teaching and seeing patients. And we're limited just by the access to vehicles.
So even though it says St. John, you're able, because the other group from saying they can only within their jurisdiction, Crown Point, you're able to go outside of St. John?
Yeah, so so right now, as referrals come in, we have 2 contracts that are currently illegal with some local hospitals. So we will see the patients in the hospitals. We're working with the fire departments to train them and get them on board and eventually get their own programs. But we're more, we want to see the patients. We're not in jurisdictional lines except for the county. So we get our patients through doctors. You guys can refer, any urgent cares, OBs, anything can refer to us.
Where do you usually go? Like, the one thing I don't always hear a lot, Lake County's even so big, is I don't hear a lot of East Chicago covered. Hobart, we just gotta make sure we're covering all the areas and not constantly in the same part of Lake County.
So just to back up from that, that's why we really are encouraging and the champions of the training, moving in. We have increasing the MIH capacity down here, also increases those paramedicine professionals that are trained in MIH who can then champion and go to other local health departments, fire departments, and get them trained and start taking on some patients or participants in those areas too. So I do know, and we know that Mike Sharp has been working with Hammond. The committee would love to see MIH being taken in Hammond. I personally think they might be a little overwhelmed. They just lost Franciscan. So, but that's not my scope. But with the consistent help and training with our implemented MIH, that would help encourage them, hopefully, and hopefully we can get more fire departments on board.
And then if I'm not mistaken, Gary got money separate because they have their own
Yes.
health department, and East Chicago got their own money as well.
Yes.
So those 2 health departments got Indiana First dollars.
Okay, so Gary, I knew had their own health department, so East Chicago has it too?
Correct.
So
How one does?
3 health departments
No, health
within,
department, Hammond no longer does.
Okay.
so 3 health departments within Lake County.
Yes.
All right.
Oh, one other question. So we had 1 vehicle, then you're jumping to 2. So I'm just curious, why are we jumping instead of 1 and adding another, just 1? Why are we jumping to 2 now?
So right now, the situation is we have 11 people. We thought, we had our average contract was showing about 20 patients a month that we would be seeing. Right now, we have 97 with 60 of those sitting in hold, because we rotate about 30 a month because of the limitations. So if you take that 30, 60, 90, we just figure with a total of 3 dedicated vehicles, we can now hit just the 90 we have with that look forward to continue to grow. We're bringing on, as Michelle was saying, we're bringing on a person from Gary Fire Department. She's learning, she's gonna learn the way that we do it, kind of look at the way that she would want to do the program in her region. She's gonna get all the training and everything and hope that will go in. Our goal is to have 1 new department come up with a mobile integrated health community paramedicine program per year at a minimum. So it's just the needs, instead of growing one, like that, one car, we just see right now that we already need the 2 extra vehicles. We could actually use 4 or 5, but to be smart, we'd like to see that slow growth, to not outweigh ourselves.
And that 90, just in perspective, that 90, you said 97, the contracts are still in process with the hospitals. So that's going to be increasing their work and referrals significantly.
Thank you. Any questions from the board? Any comments? Can we entertain a motion to approve?
Motion.
Second.
All in favor?
Aye.
And the ayes have it. The motion carries.
So next we have Mental Health America of Northwest Indiana. This was just an additional safe sleep materials. This specific request will provide funds for additional pack and plays needed to meet projected community need and scheduled events throughout the Lake County Community Action Team. This was a very simple ask. They're already a partner with us for our infant safe sleep. So this is just with the increase of materials just to cover for the remaining of the year. So needed, we thought was a fair ask. We graded a 5 and the total request was $14,250. And it was just split pack and plays and swaddles.
Rep?
Right here.
All right.
Hi. Nice to see you.
Any questions for the rep?
So you keep track that there's no overlay in the sense of like the same family? Because to be honest, I'm a pediatrician. I feel like we have a lot of overlap of car seats, pack and plays from everywhere. And so, I just don't want to duplicate or like the same family keeps or like, that we make sure that we're getting it spread around enough throughout Lake County because a lot of places offer this.
Yeah, so to my knowledge, we're the only one that's offering the actual infant safe sleep education that comes with the pack and play. And we check all of our databases. So if we get someone that comes in, once we have a referral, we're gonna run that through just to see have they been connected already. Every once in a while, sometimes we'll find out on Facebook that somebody is like selling a pack and play. Those things happen. We take it very seriously. So we cannot eliminate all, once someone has a pack and play,
Right.
they're to leave. But we really do try to make sure that we're providing one per family. And I'm really excited. Michelle knows that we've been working on this, but you mentioned the Gary and East Chicago Health Department issues. We just secured our partnerships with both of those local health departments. So they purchased pack and plays that will support residents living in those counties. So we're able to really provide this infant safe sleep education throughout the entire lake.
Excellent. Any other questions?
Where are you located?
So we have our main offices are in downtown Hammond, but we also have offices in Cherville and Cedar Lake and Valpo and Jeffrey. We're all over the place. We are connected with every single hospital. We have staff that go into every birthing hospital and offer infant safe sleep. We have partnerships with WIC and Neurosurgery Partnership. Just, there's a lot of different ways that we find families. We, in our home visiting programs, which we provide infant safe sleep education, we're serving over 700 Lake County families with pregnant and early childhood folks. With lots of community partners to get families.
All right, any other comments or questions? Can we get that in a motion?
I make a motion to approve.
Any seconds?
Second,
All in favor?
aye.
Aye.
Next, we have School City of Hobart for the Healthy Hobart program. The ask is $47,592. This is to expand after-hours access to vaccinations, offering monthly developmental screenings, and creating an ongoing referral process through home visitations and community play groups. We graded an overall 4.8 on this program, and the committee feedback was that the committee wanted to ensure that the equipment was IDOE approved. We did learn that it was. And we're also happy to be strengthening our partnership with our mobile clinic. That's part of this contract as well. So they'll be working with us on our mobile clinic in Hobart to roll out this program.
Could you explain what IDOE means for some of us who don't know?
Did you say IDOH?
Is that IDOE?
Oh, Indiana Department of Education.
It was
Okay.
for the, we inquired about the equipment for the hearing and the visual
Okay.
screening equipment that they requested. We just wanted to make sure that it was approved, that the equipment that they looked to
Standard.
purchase is approved by IDOE.
All right, thank you. All right, any reps?
Yes, I'm Deanne Jeanette. I am the program coordinator for School City of Hobart, Ricky's from the START program. We've been in existence since 2009, and so this would be a new partnership with all of you.
Thank you.
So is it our mobile unit, Lake County's? help?
Yes, we
That's
started-
sort out, because I wondered where the immunization's coming from and stuff.
So one of the things that the committee is excited about is that Hobart, Deanne Jeanette, they have the 0 to 5 play groups. So those are the exact target population that we're looking at for increasing those immunization rates to help us reach our KPIs. So we have been ramping up our efforts in Hobart with the mobile clinic, going to I forget the park. I'm in Hobart and I forget the name of the park.
Festival Park.
Yes, Festival Park, thank you. And so as they're increasing their, presence in Hobart, we'll also do that with the school.
Yeah, one of the unique things about Hobart is that we are a bit of a pediatric desert. We have one pediatrician in Hobart itself, so all of our families have to go to other locations to see a pediatrician. And we do have very high rates of parents who are signing waivers for immunization. The national average is 3.1%. And the percentage of this year of kindergartners coming into our school district is 8% are signing waivers. And in my work with the mobile clinic, I've been already kind of jumping in on that. We're trying to work together with our school nurses. They said they're extremely worried about the River Forest and Hobart school districts. This grant would cover all of the city of Hobart. We would also work with the city of Hobart in this. We have ongoing partnerships with them. Communication is a very large difficulty. And so our goal is with this program, we would be able to actually go out and canvass into the particular neighborhoods that we're having a hard time getting communication to.
And you said they're gonna try to offer vision hearing, because I know kids going into kindergarten need a vision test. A lot of times it's hard for parents to get in, with an optometrist, vision and hearing obviously is part of learning. So you want these kids like ready to go from get-go, so that'd be great if you can get the vision and hearing part in there.
Yes.
Are we doing this every day? How do you schedule it?
How will I schedule it? We will be working with the mobile clinic to target specific specific neighborhoods. And so we will.
Excuse me, specific neighborhoods in Hobart.
Yes, within the 46342 zip code. Obviously, the mobile clinic does all over, but this particular program will be dedicated to that Hobart neighborhood. One of the advantages we have is that our RNs that work in the schools will actually be able to help with these screenings. And so then we already have an established referral network that we use to try to get families to connected to service providers. And so that's what we will be doing. We also have about 1,100 children and families that come through our community playroom every year. And so our goal is then to connect them from our community playroom. We will have monthly screenings that we can get that 0 to 5 in for vision and hearing screens, and hopefully prevent some of the things that I see as the kindergarten transition coordinator. I see all these children coming in who did not receive early intervention services or who have strong speech and language delays because they didn't get their hearings tested.
All right, any other comments or questions? Can we entertain a motion for approval? Any second?
Second.
All in favor?
Aye.
Aye.
The ayes have it.
Okay, so next we have Safe Coalition for Human Rights, the Wheels for Wellness and Safety, with a $30,000 funding request. I did want to read this. The committee really valued the excellent explanation on ways that the van would be utilized. And I know Dr. Kapal will do a much better, but I wanted to read this. We were concerned whether or not one vehicle would be enough to support this program, and we felt that this was a very conservative ask, and here's why. This program will provide trauma-informed, ADA-compliant transportation to women and children who are survivors of sexual assault and trafficking. Services include emergency rescues, medical, legal, transport, child enrichment activity access, and re-entry supports. Most survivors arrive at our shelter with no vehicle, no driver's license, and no support system. Public transportation, although available, is frightening as they may be followed, unable in some areas, and entirely unsuitable for survivors who are hiding from their traffickers or abusers. When they borrow the car from their abusers, these more than likely having tracking devices. Often they are forced to obey their abuser in order to get a ride to pick up their child, buy food, medicine, or go to work. Many survivors must attend court hearings across counties, travel to forensic medical exams or substance abuse meetings and court dates, or enroll children in schools, attend school events, get their ID, WIC, and other basic needs, or participate in job interviews, all of which require travel that is safe, discreet, confidential, and reliable. And I just wanted to read all of that verbatim because I thought that that was a really great educational moment.
Thank you.
Representative?
So, well, I could withdraw it and ask for more money. But basically, we've been in communication with a van company, and they said the van is a 2016 van, ADA compliant. Some of our women, because of the rape and the multiple sex trafficking incidents that have happened over the course of the years, have severe MS. They have multiple autoimmune disorders. We have one right now with stage 3 cancer, and she's got 2 pages of medication. So we have very severely ill, chronically ill patients. And because mental health is my field and I can treat the mental health portion, we have great partnerships with colleagues in the area. They've been very helpful. In fact, yesterday a plastic surgeon said to me, he said, you know what, if these women need stitches or something, just call me. And I won't even charge you, I'll just do it. So we have a lot of support. The problem we're having is transportation. It's a very fundamental problem because these women have to escape from the traffickers. They're picked up, and we can't ask our staff or even me or anybody else to just go there in dangerous neighborhoods and pick up these people. So that transportation piece is really key. The second portion is the access and linkage to services. They have to have education. They have to get their WIC cards. They have to get, I've turned from a psychologist to a social worker at this point. So they have to go to the Social Security office. There's one lady today who we are taking around 1 o'clock because she has no identification at all. She came with nothing. Barely, and one of my residents is here, and she wants to speak. All my residents wanted to come, by the way. I told Michelle, Michelle's like, one can come. So she wants to speak. They're very passionate about this. I'm just going to let her talk.
Hi, my name is Fatima. I am one of the residents. I got there about a year ago. When I got there, I didn't have anything. I didn't have my ID. I didn't have my social or anything like that. By the time I got there, I was already in college for nursing school, but because of my situation, I was barely able, I didn't want to go anymore. So when I got there, Dr. Gopal encouraged me to go. And even though it was difficult for me to get there, at the time, I would have to take a bus to get to Purdue and Hammond, which we're in East Chicago. It was very difficult for me to get to class on time. And by the time I was done to come back, it would be very late. So I would be kind of paranoid. And just sitting in the train station at night was kind of scary. And like getting Ubers at that time is very difficult because it's a rural area. And so after graduating, after being supported, I was able to get my ID, I was able to get my social and all my documents, I was able to take my NCLEX, and I was officially a registered nurse. And I'm still there because I'm still saving money, and Nuke at Pay is the best. So paying $90 to go to work and back every day, which is like $180, is unrealistic for me. So I get home from the train station about 2-3 a.m. every night because I get at the train at 1 a.m. and I have to wait for a Lyft or an Uber, and they're rare because nobody's working at that time. So we need transportation because I am one of the residents with autoimmune disorders. So before I got there, I was really sick, and after explaining all my health issues to Dr. Gopal, I would have to wait 3 or 4 months to see a specialist, but after speaking with her, I would be able to get in the next day. And they'd be like, we're in East Chicago, they're in Maryville. So now it's like, how do I get here? I would have to take 3 or 4 hours worth of trains and buses just to get to my appointment, and then do it to get back home, and then still wait for an Uber to get back into the house. I am much better now, but a van would help me get to my appointments much faster, and they're very supportive there. When I first got there, I didn't speak.
Now I can't stop.
You have no van now, there's
Nothing. We have no transportation at all. And in response to the fact that this is an 11-seater, and the vans cost like $75,000-$80,000 if I get like a new one. I'm like, no, we can't do that. We don't want to waste money either. This is a 2016 van, ADA compliant. It has 11-seater. It'll take all our ladies. Not everybody has to go everywhere at one time, but 11 is very reasonable. And so it'll take us everywhere. We also want to help the other shelters, quite frankly, because we're not the only ones with transportation issues. So one of the things we're doing is we're having, on the 16th of June, we're having all the shelters come together. It's like, because I'm in private practice also, I never knew about all of this. I never heard about all of this. So we just don't. So we need to really expand our reach to all the local physicians, the local centers, even smaller clinics, and be able to say, hey, all this is available. I'm just listening to all of this. All of this is available. Why don't we access it for our patients?
Who's going to drive this?
Yeah. How do you
So
operate?
we have very active residents. So one of our residents is an Uber driver as well. So she says, I'll drive everywhere. We also have to hire a driver probably.
And the liability?
We have all of that.
Okay.
Yeah.
Well, you gotta have all that
Yeah,
insurance. 'Cause
insurance.
the problem is, you can't really,
cannot.
people say, any place I work, hey, let me just put them in my car and go.
Yeah.
No, you can't do
Right.
that because
And,
your insurance does not cover that. If
Exactly.
something happens or whatever, so
Exactly.
you just gotta make sure you have all
We
that stuff in
absolutely,
place.
yeah. And that's part of the grant also we asked for.
And you're located in,
East Chicago. We are moving from our 4-bedroom home to a 20-bed facility. East Chicago is working really well with us. They've been amazing, incredible. And so they're helping us acquire that house. So we're in the process of doing that. So we can take, instead of taking just 5 women or 6 women right now and like 10 kids, we can take 20 women and about 10, 12 or 15 kids. But that requires, that's another whole grant requirement.
Okay.
I'm just prepping everybody.
Okay. Good thinking.
Thank you.
Any other question from the
And then
board?
like you're partnering with like the same clinic and things to.
Yes.
Okay.
All right. Can we entertain a motion for approval?
Motion, second.
All in favor?
Aye.
The motion
Thank you.
carries. Thank you
Thanks
for
so
what
much.
you do.
Okay, next we have Hope Alliance of Northwest Indiana for the Bridge to Hope program with a funding request of $200,000. The overview, harm reduction in action provides direct and street-based harm reduction services, including overdose prevention, infectious disease education, safer use supplies. They're using certified community health workers and peer recovery coaches through direct outreach and partnerships with local, with all of the local health departments, shelters, recovery homes, food pantry, low-income housing authorities, and other community organizations. We graded this a 4.9 total. Our feedback as the committee is our great relationships with the outreach workers that volunteer here every week and assist our school liaisons with school trainings, and overall felt this was a fantastic program. And we do have Kelly.
Hello. I'm Samantha Aguilar. I'm here with Kelly Pack. So we're representing Hope Alliance.
All right, welcome.
We are Hope Alliance.
We are Hope Alliance.
All right, any comments, questions for the reps?
Again, where are you located?
We cover all of Lake County. So we actually do mobile outreach and we have outreach that we set up. So we're here at this health department on Thursdays. We're at other places throughout the week. We do 2 events a month. We partner with multiple other agencies in the area, and we are in recovery. We're very well known in the community as well, like was mentioned by some people. So we actually are very aware of all of these resources that are in the community already, and we try and get those out to people. So wherever we're needed, we go there. And we do serve about 20 people a week via deliveries and mobile outreach, about 30 people per outreach day. We do 2 or 3 outreach days a week. And out of the 2 events a month that we do about 50 to 100 people per event. And then also we're pretty big on social media. So we do a lot of social media outreach, getting resources out to the community via social media. Last month we had 200,000 visits to our Facebook profile, multiple, I don't know, hundreds of messages a week. That's where we get a lot of our mobile outreach as well. And we get lots of shares for the resources through social media as well. So.
Which shows the demand. I do want to say that the demand for the harm reduction and what we're doing it's greater than what I even knew. I mean, I know that because of our lived experience. And we've seen the demand in Cedar Lake that we never even knew. We're not reaching Cedar Lake at the moment. With this program, we'd be able to. But also, there's just areas, obviously the Hammond area, but we're aware of that. We do work with lots of community partners. Both places that were here, like the Gatehouse, that's one of the people on our wait list because they asked us to do Narcan trainings there. They asked us to do HIV out, education and substance abuse prevention things there. So we have like a wait list, and with what we've been doing right now, we've just been reaching many. And one of the best things with the community health workers that we have, it's the bridge between. That's why we called it the bridge to hope. It's the bridge between the people that, I know we have doctors' offices and we have hospitals and we have there, but we're talking to people and getting them actually care and tested that would not normally come to a doctor. We have people coming to this, I have people coming to this health department when I keep showing up and we keep going to the same places. It allows people to eventually come, so now I have people coming to this health department that normally would not come to a health department or, to doctor's offices where we refer to aliveness, we refer to lots of places. So, yeah.
What are funding sources do you guys have?
Well, it's a great question. We have, in-kind donations, and then the volunteers are all, our volunteers, like we are volunteers, we just volunteer.
Okay.
I'm sorry, where did you say you get other funding from?
In-kind donations from churches, and, then our
Volunteers
volunteers.
were self-funded.
And we get, donations, you know, for our emergency contraceptives, so all of our, what we have at the moment is all donated.
The one thing, I mean, because I know everybody's got to get paid and things, but I noticed that 160,000 out of the 200,000 is salaries.
Yes, so actually, it's,
So that's like, you know.
it's like a capacity administrative, so all of what we do is basically on the workers. So all of our supplies, our partnerships and donations, but it's how do we get them out there without a worker? Because so much of what we do is reliant on our workers who are community health workers, certified community health workers, certified peer recovery coaches, everybody that volunteers with us or works with us. They're all trained. They go through either trainings or we get them additional education. So they're in the community with anti-stigma education, Narcan training information, maternal information, smoking cessation information. So a lot of what the funding is for is because to get this out there, like boots on the ground, to get these resources connected to the people that we're not reaching is through the outreach workers who are going to be the ones in the community carrying all the information.
And you guys keep track of
everything.
Training, like their training, their certification, you know,
Yes.
like we got like
Yeah.
background checks or so.
I will add to that. We see a lot of people offering Narcan training throughout the community. One thing that sets Hope Alliance apart is they are partnered with the Overdose Lifeline training. So when they give you a Narcan training, you go through an entire curriculum from the Overdose Lifeline and you receive a certificate. So you may see people kind of repurposing Narcan training, but theirs actually comes with a certificate that they can provide to the person that they're training or the organization.
Gold standard of
Yes.
Narcan trainings.
And Overdose Lifeline, just the month of May, just with working with the school liaisons here, I think the number was,
Around 600.
the number of Narcan trainings just with the school. That's not how many we did. We trained, I think, 75 people just with the schools that we went to, you know, that's the month of May. You know, and went to the, 75, I think it was, or 74, yes.
Any questions, comments? Can we entertain a motion for approval?
Motion.
Any seconds? Any seconds?
Yeah, I'll second.
Okay, all in favor?
Aye.
No?
Do we need to do a roll?
No. You're, okay, absent, okay. The motion carries then.
I just need to clarify, are you abstaining or are you voting no?
I'm voting no.
Voting no.
Okay, all right. The motion carries then. All right, well, congratulations. Next one.
Okay, next we have Prenatal Well Early Connect program. This is an ask of $200,000. Early Connect provides rapid prenatal care coordination, transportation assistance, trimester-specific education, nutritional support. These services are delivered through a hybrid model of in-person and virtual support, ensuring timely patient-centered care beginning within that 48 to 72 hours of referral and continuing through postpartum. Overall, we did grade this program a 3.8. The committee has reservations funding a startup clinic. While the program itself was very well viewed, the Early Connect itself, and it would be free to residents once the clinic is established. The concern is that no funding was allocated directly to the program Early Connect, rather than being connected to the clinic.
This was the program where it was a provider and it was sort of a freestanding clinic, correct, that we went over before?
I believe so. We do have a representative here. We have Dr. Dominique.
Hi. So what hospital did you look at?
So I was previously with Methodist Hospital. I worked for North Shore Health Centers for 4 years. So I just transitioned to become a locums physician in order to start a clinic like this because of the maternal morbidity and mortality that I saw in the area and the issues with connecting women. So these women would come to my clinic and they wouldn't get prenatal care until 20 weeks, 24 weeks, only because of the barriers to access that are the issue in this area, which then allowed me to say, I need to do something different. And I stepped away and became a locums physician in order to start this.
Okay. My issue I had was, because obviously that's a good service to provide, but I felt like the funding was actually going to set up your office. It wasn't like we weren't funding this program, Early Connect, we were actually funding your own office to be set up with everything.
Well, it's not that it's necessarily funding my office, it will be through my office. However, if I start my office, which I'm planning to start my office anyways, I will not be able to do this type of program if I don't receive this funding. So this funding is specifically in order to start Early Connect at the same exact time that the office is actually being started. So for instance, during that time, it will allow me to be able to connect the women to their providers. For instance, with Dr. Gopal, I was at her clinic, or not her clinic, but I was at her house yesterday. So I go into these homes, I have a lot of connections with the community. And so I was able to get an appointment through, social access as being a physician to her patient pretty much the following day. And so typically these women come in, they're not able to receive these appointments. However, this program, the funding is in order to start Early Connect within the office.
What kind of capacity would you anticipate for this program?
So with this funding, I'm anticipating to have around 100 women that I'll be able to serve. So I'm believing that we'll have about 25 women that will be able to quarterly be able to enroll into this program. As the women come in, as we've had a lot of questions, how do you have access to these women? So as a physician that already has referrals from Methodist Hospital and associated with multiple hospitals in the area, also I'm affiliated with the Women's Care Center, as well as the urgent care clinics. A lot of these women are coming to the office. They will come to North Shore, receiving their first ultrasound or receiving their pregnancy test from those centers. But there's a gap between the women actually getting the appointments. Sometimes that comes from the women not knowing exactly what to ask. Sometimes that comes from them not being able to just get access quickly. And so that's why we will be able to come in. These women, we get them directly from their initial positive pregnancy test. And then I will connect them to their appointment within the 48 to 72 hours. So we can stop that long time before the women are showing up. But not only that, the purpose of Early Connect is to stay connected to the patient. So then we follow back up with that patient to ensure that they got that appointment, that they went to that appointment. So it's all full wraparound services within this. And so Early Connect is more than just connecting the 48 to 72 hour referral. You also have women that are able to get a bi-weekly nutrition box from Faith Farms, which we have a connection with them. So we're going to be doing connections with that, as well as through the KPIs that during the application, just by nature of the program, we will be hitting so many KPIs just by the nature of the program in general, not necessarily just the referral that is there.
How would your program be different from what they are doing at North Shore?
So at North Shore, you're just getting your first appointment.
Okay.
So the difference is that we're getting these women at their pregnancy test, their first pregnancy test. So as a physician that's worked in this area for 4 years, I have a very large connection with the women. I have women do trust me in this area. Women are actually waiting for me to come back to this area so they can come and receive my services. And so it's different because as a physician there, I would see these women showing up at 20 weeks. Well, why weren't you able to come? Oh, I didn't have the transportation to get here, which is something that Early Connect will be able to do. Oh, well, when I called, they said that I needed to go see another provider because they didn't realize that I actually need to see an OBGYN. So it all slows that process down. So, as we know, advocating is something that is huge, right? For these patients that don't really know exactly the next steps or what to do. And so that's where I step in as being the advocate in order to make sure that they get to the right provider in the right time, as well as the additional.
How would anyone know that you're there?
So I have, again, it's with the ER departments. So I have connections with the ER departments. So they will directly connect me they would refer to me, and I would contact the patient in order to give them the appointments that they need. So it's the ER departments, it's where the women come in contact with their first pregnancy test, which is different than any program that exists that I've ever seen, which is what made me come up with this idea. How can I get to the women from the very beginning? When they receive that pregnancy test, when they get that ultrasound, how do we get them connected at that point?
You have had association with many women recently, correct?
Yes. So Prenatal Well does a women's annual wellness fair beyond a baby shower. So we are in contact with over 600 individuals. This happened we just had our wellness fair April the 26th. Majority of all the partners that were here, we have been in contact with each of those partners that were there at that event. And so, yes, I'm in connect. Like I said, I was just at Dr. Gopal's home. I have a connection with Ashley's house, where I go to Ashley's house and provide services to them. This, of course, on a volunteer basis, in order to make sure that these women, and one woman came in there and she wanted to know, well, how can I get in contact with you and your clinic in order to ensure that I have everything that I need in regards to my gynae care and things like that.
I don't know. My problem was it was a lot of money, and I felt like it was a startup for your office, because when anybody goes to an ER and they need to be referred to other places, they'll list everything. They'll list most clinics, FQHCs, mainly FQHCs on the list. So my issue was, certainly we want people, if they're pregnant, to get in as soon as possible. But I thought it was a lot of money and not specifically really directed to this actually early connect, because I've worked at 2 FQHCs and we have prenatal programs that really try to get the moms early and stuff. So there's a lot of programs out there. I personally just thought it was a lot of money for this actual specific early connect. I mean, I don't have an issue with some money. I just thought 200,000 was a lot of money.
Can I say something in regards to, yes, you're right. So they will give them a referral to those places, but that's where the disconnect happens. So what creates the patient from showing up to me at 24 weeks? Like, why aren't they getting there? So it's just that they're giving these women a piece of paper. From what you can hear, from what I've heard from these patients need an advocate for them to walk them through that process. And it takes funding to do those things. So not only is Early Connect, it's not the clinic, it's also, I have IRB, I've already talked to Methodist, so I'm not just doing this to actually just create a program. This program is actually going to be looking at the numbers and the difference that we're making in the community. And so I've already talked with Methodist Hospital, which we will be going through their IRB, where we will be actually looking at the numbers of the women and what the difference that we're actually making. So when they receive,
So I'm sorry, you'll be doing a study with Methodist?
So Methodist
taking to the IRB, because that's an institutional review board for a study.
Yeah, so it's not that I'm necessarily doing a study with Methodist, but I have talked with Methodist, because one thing that we realize is we don't have the numbers that exactly, like, what is the issue with these women coming in for the late initiation prenatal care. And so we're looking to see what the difference that Early Connect will make in order to ensure that those things are taken care of, right? And so how do we do that without research? I can institute a program, but I need to know how this program is working in order for future funding in the future.
And if I can add.
Yeah, please.
Hi, my name is Otis Dominique. I'm the operations director for Prenatal Well. I don't think that's accurate that none of the money is going to Early Connect. Early Connect, to have this program work, is going to require people, systems, and processes. And that's where a lot of the money is going. So a lot of the money is going to administrators because we need the administrators to drive and create this highly coordinated program to get these women to the services that they need.
Okay. Any other questions or comments? Yeah, can we entertain a motion for approval? Okay.
Which you,
Huh?
I'm sure they'll be
Yeah.
right. I mean, what you're saying is true.
Yeah.
You know, because when the girls come to the emergency room and they say, oh, I have a problem or I'm bleeding, you do a pregnancy test and it's positive, they do give you this. You know, they give you a sheet of paper. And then you have to determine where you're going. But if that person is related or directed directly to these people, you would get there a lot quicker. You would get the treatment that you need a lot sooner. Because now we have to call, so have to call whoever, try to get an appointment. They tell you you have an appointment, then, you know, much further away than it should be. Whereas I think this is a much
I
better.
think it's a needed service.
It is a needed service.
Okay.
So
Can you make a motion?
I sure will. I'll make a motion that we accept this program at this particular time, the prenatal well, early from that.
Any seconds?
Oh, we muted Dr. Fourier.
I'll second it.
All in favor?
I'm a no.
You know?
Oh, no.
Yes.
I,
And
so we have
3
three ayes and then
Four
aye.
ayes.
So do we have a motion carried?
right.
All right.
So I think will 4 do it, because we
How many?
I think we
we need 5,
We need a form of 5.
because we need to have 5 ayes. Or
We need-
yeses.
How many people are in, how many, 6?
You have 6 here, but we have a total of 9 positions on the board.
Okay.
Only 8 are active.
Right, only 8 are
And
active.
we would need a quorum of 5 in order to carry.
Okay,
So we need
quorum to have the meeting or quorum to have the meeting or quorum to, and when we vote, once you have the quorum,
Let
the
me
people
text
who
him.
are there are supposed to be able to, otherwise we won't be able to function.
But that's, when we don't have
Yeah, yeah.
everybody here.
Yeah, no, once you have a
I thought it
quorum,
was a good program. I thought it was too much money they were asking.
okay, well, that.
I thought once you have a quorum, the majority
Yeah,
will.
exactly, the majority, otherwise you can't function.
I don't know, I'm not an attorney.
We're not attorney. We're gonna see if Amishi can respond.
Okay. Yeah,
Of the people in the room?
yeah.
I would think.
It is?
so,
Oh,
yeah.
okay.
Yeah, because if you're gonna wait for 9, we'll never move. So
Okay.
the motion carries.
The motion
We'll go with
Okay.
motion carries?
Yeah,
Okay.
all right. Okay, congratulations. All right. So we're at the end of this program. Any questions? And now to the audience, the public, any public comment, 3 minutes? I think we have passed our time, but we can entertain one. Yes, ma'am.
Good morning.
Good morning.
My name is Connie Martin. I am the executive director of the Papa House. And in addition to learning about all the programs that you're funding as you have the Papa House, I wanted to take the opportunity to provide you with the press release and the flyer for our youth wellness initiative, which is we're taking teenagers 12 to 17 to camp this summer. And I provided the press release and the flyer to Amanda, but I wanted to make sure that I share the information with the board and the members attending this meeting in the community. So that if you have a 12 to 17-year-old that you'd like to give this wonderful opportunity for youth wellness and mentorship, then we have started our registration process. And we're about halfway there, and our capacity is 48. We have 2 cabins, so we can take 24 girls and 24 boys to the camp. So I wanted to share that information with you. And if there's any way you can help us promote it by posting our flyer in your doctor's offices, etc., then let me know. We'll get that information.
Where's it at? Where's it?
Jamison Camp in Indianapolis, Indiana.
It's where, Indianapolis?
Yeah, it's called Jameson Camp, and it is located in Indianapolis, Indiana. It is a state-of-the-art camping facility with 130 acres of meadows and streams. It is a gym.
And I can second that.
Yes.
I used to volunteer there years ago, and it's absolutely beautiful. And it's, yeah, what a great opportunity for kids to go down there. And when I did it, it was kids that were affected or infected by HIV. But this is a different program. Obviously, we're changing things up, but it's wonderful, and I absolutely enjoyed volunteering there. And I'm glad. I'm Denise.
Okay,
I'm the one
nice
that's
to meet you.
communicating
We've
with
been
you. So
communicating.
yeah, it's I highly recommend it to anybody who would be interested in. It seemed very, very, very safe, and the kids had a blast.
Oh,
I
yeah.
had a blast.
They
It was
are.
fun.
It is very safe. They've been accredited for 100 years. Their staff actually sleep in bunk with, those that are attending. We can augment their staff. Everybody has to be background checked, but nobody can come on the grounds that has not had a background screening. And our program is regardless of race, regardless of income. We want to make sure that, and it's substance free and social media free. So
detox.
Right?
So,
Yeah,
and they don't realize, we had to compensate a few phones, but at the end of the camp, they don't even think about social media.
They are outside, they're doing archery, they're fishing.
Zip
I mean,
lining.
they are connected with nature and just
Can grown-ups
building
come too?
relationships. Yeah, right? Yeah, it's awesome.
The Jameson Camp, they do entertain other, possibilities for team building, etc., in that environment. So you should give them a call, but I want to give an update.
Thank you very much. That's a
Thank
very
you.
good
Nice to
update.
meet you.
Nice to
One
meet you.
quick question. How do you get, one quick question, kids from Lake County, how do they get to Indianapolis?
Transportation, we're providing round trip transportation. We're gonna be leaving from Crown Point, Indiana, the Purdue Technology Center, which is where my office, my professional office is located. So, and so we're able to leave our cars there. So we're leaving from Crown Point, Purdue Technology Center, and then we'll return to Purdue Technology
So
Center.
they're this from the 20th to the 25th.
To the 25th without social media, yep.
Excellent.
So that's the hardest part for them, otherwise. Other than that, it's a wonderful
Thank you very much for coming back to let us know our program is working.
Absolutely.
Thank you. Well, can we entertain a motion for adjournment, unless there's a comment? Yeah? Oh, yeah.
What about the board study session that's on the agenda?
The what?
So there were two items in the entry that I had put on there. One, to discuss the possibility of board study sessions going forward, because our meetings, we don't quite have enough time to get through everything.
Yeah.
And then I also want to discuss new fees for service. That can wait, and I can send you that through email. It's more about just getting your feedback, not anything to vote on. So if you would like, we can discuss those now, or if you would like, we can do it through email to get your feedback and talk about it at the next meeting.
Okay, yeah, let's move those because most of us need to go to work.
Yeah.
All right,
The health board needs to meet more often.
Are you doing your comment
Are you
period? I'll
doing
go ahead
your
and start the
comment?
timer.
yeah. Okay,
Okay, go ahead.
The health department needs to meet more often or have longer meetings. This just isn't sufficient. My comments today concern two things, and they come up again and again: duplication. Prior to this time, duplication was not considered to be a great thing, but as of today's meeting, I guess duplication is okay, which is rather surprising. Why doesn't the health board just decide on a pool of money for all the people asking for grants for opioids, all the people asking for grants for maternal, et cetera, and then divvy it up instead of doing all these separate grants? My second comment is about how do people find out about these programs? when you drive on 8094, you see a couple big billboards by Franciscan. And all they say on them is, one says, live your best life. And the other one says, live your extraordinary life. Now that's rhetoric. These are expensive signs. They're at least $4,000 for the month. And I don't see any beef here with these programs. We talk about entry points and referrals and everything else. Why don't you have billboards if these programs really exist and say, attend a healthy cooking class, second Wednesday of every month at such and such and such a time. That's what we need for these programs. You're using the same old fashioned ways that you have been done forever. And I don't think it's adequate. I'm done.
Okay.
So I would just like to comment on the allocation of the funding. So originally in 2024, we didn't have any partnerships established through HFI. So we had open applications, and then we knew that through the data and everything that I presented since coming on board, what our top priorities were and where we were heading in that regard. Come to January 1 of 2025, we know that our top priorities are maternal child health, trauma and injury prevention, which is that overdose prevention, getting our pregnant mothers into the prenatal assistance program, making sure that we're lowering the cases of congenital syphilis, and increasing our immunizations. We're at number 90 in 2024 of 92 counties. So we knew kind of what our focus was when looking at and reviewing these applications. Now we have a community needs assessment that's going to be rolling out soon, and that's going to further drive what we're exactly looking for. So I believe what I'm gathering from you is that you're looking for more of a request for proposals. We're looking for this program specifically, or this type of program specifically, and drawing in those. Am I understanding that?
I feel like there's nothing this health board won't fund, and it'll fund it again and again and again.
So that is why we've established the internal review committee, so that we can look and review and determine as a committee where there's multiple eyes on it. Okay.
Okay, any other comments?
All right, yeah, go ahead.
I'm sorry, the one thing is, I think with Michelle doing this,
Yes.
is going to make the system better, because those graphs showed us, because I agree with what you're saying, I think a lot of this is duplicate, overlap. I mean, you know, I've been in urban community working for over 30 years. And every FQHC has its own prenatal, maternal, infant, slave sleep. We all have our own programs. So I feel like a lot of this is overlap. For transportation, all you have to do is call the back of your car. Transportation is offered for all Medicaid patients to get you to your appointment and bring you home. So a lot of this is duplicate, but I think because of the way Michelle has this now, that we can look on here and see exactly, like, if this money's already going to this kind of program, this money's, I think since she just rolled it out, I do think it's better. And my last comment I want to make is that maybe this needs to be more internal, but there are some board members, I've only been coming to this since September 2024. There's some board members I haven't seen one time here.
Some of them
And
I've
I
never
think this
seen.
is a responsibility for Lake County for this money. So internally, we have got to see, you know, the ones that aren't coming, they need to be removed and somebody else put on there. They have to.
I think that will fall to the commission, because they are the ones appointing us. So I think we need to let the commission know that there are some board members who are not showing up. Some people I've never seen them. I've been here almost 10 years.
That's ridiculous.
Yes, that's not.
That's
not
inexcusable.
right. Yes.
Boom, you have to.
Yes. I'm
Take
glad
the
you
job
brought that up.
take it responsible.
Yeah.
Responsibility
If you can't
to
come, if you can't do it, don't come.
Right.
This is mostly a volunteer kind of stuff. We are here because we want to make sure that healthcare, population health in Lake County is well done. So those who are not interested should not hold on to the position.
Exactly.
And let people who are interested in public health, come on board and help us out.
Yep.
With the expertise. All
So
right?
do
Yeah.
do you write the letter, or Dr. Balilava?
We can talk to Amishi
Yeah,
and see
please.
what action should be taken.
Yeah, we talked to
Okay.
the
But I
lawyer.
think we really have to, this is,
Okay.
it's the same, it's us.
Yeah.
Michelle has, I know we're all busy, Michelle, this is volunteer. But I know we're all invested to do the best care for Northwest Indiana, but Michelle has things like 2 weeks usually before to go over these. And it's even the fewer the numbers that come, and I know since we always come here. The same, we want to be responsible, know what we're voting on. I'm not gonna just vote on anything. I'm not gonna be just yes. So we need to get the board members who aren't coming, they need to be removed.
Yeah, all right.
The other thing too, when you go to do your community needs assessment, this is totally off this other topic, but I don't want to lose my train of thought, is that please know that every hospital system has to do a community needs assessment. So as they're doing theirs, it would behoove us to get copies of theirs. And so that we can make sure that everything is prioritized and that it's working together. Does that make sense?
It makes sense, yeah. All right.
And then I just want to know real quick, Michelle, you were correct. I mean, she replied and said that it would pass because the votes in the room were 6-2.
Oh, thank you,
4-2,
appreciate
sorry.
that. All right, can we entertain a motion for adjournment? Yeah,
Here, one short thing. You know, somewhere in all of this, there's a lot, and I can't even thank you, Michelle, enough how far you've come between your first KPI and this. It's phenomenal.
And you too.
You need a cruise director, and I really notice you being that cruise director, and that's phenomenal, because then people can get behind you. And as far as this is not a duplicate of anything, but the amount of money, if we could start in our schools, in our communities, bring back the whole concept of waiting to have sex, not making it cool anymore. It has to not be cool anymore because it's hurting women, it's hurting children. Why is there so much sex trafficking in Northwest Indiana, in our area specifically? We have it's a problem. And so part of it is, people need to not, when you're teaching moms how to mom, teaching them how to parent, there's no reason for kids to be out after 6 or 7 o'clock at night. There's just no reason. And that stops a whole lot of things that happen to young girls that shouldn't be happening to them in bad environments. So that's my only, I know it doesn't have anything else to do with it, but I just wanted to put that out
Hey,
there.
can you just unmute Dr. Forey real quick so we can see if he has. Dr. Forey, did you have any comments or anything?
He has.
I want to thank you for setting up the Zoom. I appreciate it very much.
Yeah. Thank you for being there.
I appreciate it. Thanks for allowing me to attend from a distance.
Thank you. All right.
Abstinence was the word I was looking for. Abstinence was the word.
Okay, can we entertain a motion for adjournment?
Motion to adjourn. Reynolds, yes.
And the second. All in favor?
I'm gonna be going straight to work, so this is gonna sit in my car and
Thank you.
I'm taking over. I'm putting you in charge of that. Otherwise, it'll just.
Thank you. So one thing too,
What I've learned with our state is this
Thank you for what you do. That's a very good job. Makes it so much easier. It makes it very digestible.
Take care.
Thank you very much.
Thank you very much.
Okay.
Thank you, everybody. If you have any comments on improvement of the process, let us know.
No, you guys are doing a
Okay,
great
good.
job. This is so much better. Yeah.
The only reason I said that,
Thank you for coming. Good seeing you.
They said they